Hello, I'm Dr. Nicole LePera. As a holistic psychologist, I've spent years guiding people to take ownership of their health, not just mental, but physical as well. One thing I've learned through this work is that healing happens when we look at the whole picture. That includes the body, the mind, and the choices we make every day. Today, I want to talk to you about a subject that affects millions of people: blood sugar regulation. If you're living with diabetes or are at risk for it, you know how complex this condition can be. But here's the truth that often gets overlooked. One single vitamin, when taken consistently, has shown powerful results in helping to stabilize blood sugar, support insulin sensitivity, and protect the body from long-term complications. In this session, we'll dive deep into how this vitamin works, what science says about it, and how you can start using it safely. My goal is to simplify this topic so you can feel more confident, more supported, and more empowered in your journey with diabetes. Let's begin by exploring what this essential vitamin is and why it matters so much. Part 1. The missing piece: vitamin D. When most people think about diabetes, they think about insulin, sugar, or the pancreas. Rarely do they think about vitamin D, but over the last decade, more and more research has pointed to this humble nutrient as one of the most powerful natural supports for people managing diabetes. Vitamin D is often called the sunshine vitamin because our bodies make it when exposed to sunlight. But here's the issue: most people are not getting enough. Especially adults over the age of 50, people with darker skin, those who live in northern climates, and anyone who spends most of their time indoors. And this deficiency is far more than just a risk for weak bones. It is deeply connected to blood sugar regulation. In fact, recent studies show that low levels of vitamin D are directly linked to higher blood sugar, increased insulin resistance, and greater risk of developing type 2 diabetes. That means vitamin D is not just important for prevention, but also for supporting those already living with the condition. I remember one of my patients, Linda, who was diagnosed with type 2 diabetes in her late 50s. Despite following her doctor's advice, taking medication, and eating better, her blood sugar remained unpredictable. Her energy levels dropped. Her mood was low, and she started to feel like nothing was working. When we checked her vitamin D levels, they were severely deficient. After just 8 weeks of daily vitamin D3 supplementation, something shifted. Her fasting glucose numbers improved. She had more energy. Her cravings decreased, and for the first time in months, she felt hopeful. So how exactly does vitamin D help? First, it improves insulin sensitivity. Insulin is the hormone that allows sugar to enter your cells. When your body becomes resistant to insulin, sugar builds up in your bloodstream. Vitamin D helps your cells respond better to insulin, which can lead to lower blood sugar levels. Second, vitamin D supports the function of beta cells in the pancreas, the very cells responsible for producing insulin. Without enough vitamin D, these cells struggle. With proper levels, they can work more efficiently, producing insulin at the right time and in the right amount. Third, vitamin D is a natural anti-inflammatory, and inflammation plays a central role in the development and progression of diabetes. Chronic inflammation disrupts insulin signaling and damages blood vessels, nerves, and organs. Vitamin D helps calm that inflammation, offering protection throughout the body. Finally, vitamin D improves immune function. People with diabetes are more likely to suffer from infections and slow healing. Vitamin D strengthens the immune system and reduces the risk of complications that stem from high blood sugar. Now here is what the research shows. A study published in the journal Diabetes Care found that people with high levels of vitamin D had a 38% lower risk of developing type 2 diabetes compared to those with low levels. Another study followed over 3,600 participants and found that for every 4 nanogram per milliliter increase in vitamin D, there was a 5% reduction in diabetes risk. Clinical trials have shown that people with diabetes who take vitamin D supplements regularly can experience lower fasting, blood glucose, reduced A1C levels, and improved insulin sensitivity within just a few months. That is a lot of good news from one simple vitamin. But how much do you really need? And what is the best way to get it? That is what we will explore in the next section. Part 2. How to get enough vitamin D safely and effectively. Now that you understand how essential vitamin D is for blood sugar balance, insulin sensitivity, and inflammation control, the next question becomes, how do you get enough of it? There are 3 main sources: sunlight, food, and supplements. But for most people, especially those managing diabetes, supplementation is the most reliable and effective method. Let me explain why. First, let's talk about sunlight, which is the most natural way your body makes vitamin D. When your skin is exposed to UVB rays, it triggers a reaction that creates vitamin D in your body. Sounds simple, right? But here is the complication. As we age, our skin becomes less efficient at producing vitamin D. People over 60 may produce less than half as much vitamin D from the same sun exposure compared to younger adults. Also, factors like skin tone, sunscreen use, clothing, latitude, and season play major roles. In the winter, especially in northern climates, the sun is simply not strong enough to trigger vitamin D production, even if you are outside for hours. That is why food becomes the next option. Here are some vitamin D-rich foods: fatty fish like salmon, mackerel, sardines, and tuna; cod liver oil; egg yolks; fortified foods such as milk, orange juice, cereals, and plant-based milks. The challenge? Even these foods contain relatively small amounts of vitamin D. You would need to eat salmon every single day to meet your minimum needs, and for most people, that is not realistic. Which brings us to supplementation, the most effective and consistent method, especially for people with diabetes or low blood levels. So how much vitamin D do you actually need? For adults over 50, most experts recommend at least 1,000 to 2,000 international units, IU, per day of vitamin D3. Some individuals with deficiencies may need even higher doses, up to 5,000 IU daily temporarily, but always under the guidance of a healthcare provider. Blood testing is the best way to know your current vitamin D status. Your doctor can measure your 25-hydroxyvitamin D level. The optimal range is usually considered to be between 40 and 60 nanograms per milliliter. Below 30 is considered deficient. Below 20 is severely low. It is also important to know that vitamin D is fat-soluble, which means it is best absorbed when taken with food that contains fat, like avocado, nuts, olive oil, or full-fat dairy. That is why I recommend taking your supplement with your largest meal of the day for best absorption. I also want to stress the importance of choosing vitamin D3, cholecalciferol, not D2. D3 is the form your body naturally makes from sunlight, and it is far more effective at raising and maintaining healthy vitamin D levels. There are even combination supplements that include vitamin D3 with vitamin K2. This pairing is important because while vitamin D helps with calcium absorption, K2 ensures that the calcium goes to your bones, not your arteries. This helps protect both your skeleton and your cardiovascular system. What about safety? Vitamin D is very safe when taken in the proper range. Toxicity only occurs at extremely high doses taken over long periods, usually more than 10,000 IU per day for several months. That is why it's wise to get your blood tested every few months if you are supplementing regularly, especially at higher doses. Now let me share a few quick examples of how this plays out in real life. A woman named Carol, age 64, was struggling with both diabetes and chronic fatigue. She supplemented with 2,000 IU of vitamin D3 daily, and within 8 weeks, her energy improved and her blood glucose stabilized. A man named Raymond, 71, had very low bone density and high A1C levels. With a regimen that included 5,000 IU of vitamin D3, omega-3s, and magnesium, his bone scans improved, and his doctor reduced his diabetes medication. These are not miracles. They're what happens when your body gets what it needs to function properly. But there is more to the story. Vitamin D works best when it is paired with certain lifestyle choices. That is what we will explore in the next part. Part 3. Pairing vitamin D with lifestyle for maximum impact. While vitamin D on its own is a powerful ally in diabetes management, the real magic happens when it works in synergy with healthy lifestyle choices. Think of vitamin D as the foundation, but what you build on top of it determines the strength of your health. In this section, I'll walk you through 5 essential habits that, when combined with proper vitamin D levels, can help reduce insulin resistance, lower blood sugar, and even reverse early signs of diabetes-related complications. Let's start with movement. Physical activity is one of the most effective tools for improving insulin sensitivity. When you move your muscles, whether it's walking, stretching, dancing, or lifting light weights, your cells become more responsive to insulin. That means your body can move sugar out of the bloodstream more efficiently. Now, when paired with adequate vitamin D, that improvement becomes even more pronounced. Studies show that physically active people with healthy vitamin D levels have better fasting glucose numbers, lower A1C levels, and improved overall mood. Exercise also helps boost vitamin D activation in the liver and kidneys, so it works both ways. Next is nutrition. What you eat directly affects your blood sugar, but it also determines how well your body absorbs and uses vitamin D. A whole food diet rich in healthy fats like avocado, olive oil, walnuts, and wild-caught fish supports vitamin D absorption. You also want a balance of fiber-rich carbohydrates, such as lentils, beans, berries, and leafy greens, to stabilize blood sugar naturally. Let me share an example. Maria, 68, had erratic blood sugar and was on the edge of insulin dependency. She started a morning routine that included a vitamin D3 supplement with a high-protein breakfast, eggs, spinach, avocado, and a sprinkle of chia seeds. She added short walks after meals and reduced sugary snacks. Within 4 months, her fasting glucose dropped by 20 points and her energy improved dramatically. The third pillar is sleep. Sleep impacts blood sugar more than most people realize. Poor sleep leads to increased cortisol, higher glucose levels, and greater insulin resistance. Vitamin D helps regulate sleep by supporting melatonin production, the hormone responsible for healthy sleep cycles. One study published in Endocrine Journal showed that people with low vitamin D were more likely to have disrupted sleep and higher blood sugar readings the next day. When participants supplemented with D3, their sleep improved, and so did their glucose control. Fourth, let's talk about stress. Chronic stress keeps your body in a constant state of fight or flight. That means more cortisol, more blood sugar, and more insulin resistance. Vitamin D helps regulate the adrenal glands and supports your nervous system. This is one reason people feel calmer and more emotionally stable when their vitamin D levels are in range. I recommend incorporating calming activities into your routine, such as deep breathing, journaling, nature walks, or simply being quiet for a few minutes each morning. When your mind relaxes, your hormones and blood sugar begin to settle as well. Finally, there is gut health. The health of your gut lining and microbiome plays a critical role in how you absorb nutrients, including vitamin D. A healthy gut allows for better hormone regulation, immune support, and blood sugar stability. Fermented foods like sauerkraut, kimchi, kefir, and plain yogurt help nourish your gut, while avoiding processed sugar and artificial sweeteners keeps inflammation low. For those struggling with digestive issues or leaky gut, a good quality probiotic taken alongside vitamin D can improve both absorption and overall metabolic balance. Now let's connect all of this. If you take vitamin D but you are not moving your body, eating well, sleeping, managing stress, or taking care of your gut, your results may be limited. But when you combine all these tools, even just small steps in each area, the benefits of vitamin D are amplified across your entire system. You don't need to change everything overnight. You can start small. Maybe you take your vitamin D supplement with a healthy breakfast. Maybe you go for a 10-minute walk after dinner. Maybe you turn off your phone a little earlier each night. It is these small, consistent actions, when done together, that shift your health in meaningful ways. In the next part, we'll go even deeper and explore how vitamin D protects your body from long-term complications of diabetes, including heart disease, nerve damage, and kidney decline. Part 4. Long-term protection. How vitamin D guards your organs. Living with diabetes means thinking not just about today's blood sugar, but also tomorrow's health. Over time, consistently high blood sugar can damage blood vessels and nerves throughout the body. That's what leads to diabetic complications, the ones no one likes to talk about, like vision loss, kidney failure, nerve pain, and heart disease. But here's what many people don't realize. Vitamin D plays a protective role in each of these systems, helping reduce the risk and slow the progression of damage. Let's begin with the cardiovascular system. People with diabetes are at much higher risk of heart disease and stroke. High blood sugar damages the lining of the blood vessels, increases inflammation, and raises blood pressure. But research shows that vitamin D helps protect the heart in several ways. It improves the elasticity of blood vessels, reduces arterial stiffness, and helps regulate blood pressure. It also lowers the level of inflammatory markers like CRP, a key predictor of cardiovascular events. One large study showed that people with sufficient vitamin D levels had a 33% lower risk of heart disease compared to those who were deficient. Next, let's talk about the nervous system. Diabetic neuropathy affects nearly half of all people with diabetes. It starts subtly. Maybe a tingling in the feet, a burning sensation in the hands, or sharp shooting pains in the legs. Over time, it can lead to numbness, loss of coordination, and even dangerous wounds that fail to heal. Vitamin D helps protect the nerves by reducing inflammation around them and supporting the repair of myelin, the protective coating on nerve fibers. It also supports calcium balance, which is essential for healthy nerve signaling. In clinical studies, vitamin D supplementation reduced the severity of neuropathy symptoms in diabetic patients and even helped restore some sensation. One patient I worked with, Robert, age 70, came in complaining of numb feet and frequent nighttime leg cramps. He'd been diabetic for over a decade. After testing, we found his vitamin D level was severely low. After 3 months of consistent supplementation and movement, his cramps decreased, his walking improved, and he began to regain some feeling in his toes. Now let's turn to the kidneys, which are especially vulnerable in diabetes. When blood sugar is too high, it damages the delicate filtering units of the kidneys. This condition, called diabetic nephropathy, is one of the leading causes of kidney failure. But vitamin D helps support kidney function by reducing protein loss in urine, slowing fibrosis, and decreasing inflammation. One meta-analysis found that vitamin D supplementation significantly reduced the amount of protein in the urine, a key marker of kidney stress. Other studies show improved kidney function and less oxidative damage when vitamin D is added to a diabetes care plan. What about vision in the eyes? Diabetic retinopathy is another complication caused by damaged blood vessels in the retina. Over time, this can lead to blurred vision or even blindness. Vitamin D helps by improving blood flow to the eyes and reducing the vascular damage that leads to retinal bleeding and swelling. Now let's touch on immune function, because diabetics are more prone to infections and delayed healing. Wounds that do not heal properly, especially on the feet, can lead to serious complications, but vitamin D boosts immune strength, supports skin regeneration, and reduces the risk of infection. It helps your body respond faster and more effectively to bacteria, viruses, and inflammation. In all of these areas, heart, nerves, kidneys, eyes, immune system, vitamin D offers quiet but powerful protection. It is not a magic pill, but it is a strong and reliable ally. And the earlier you start, the better the results tend to be. Many complications do not show symptoms until they are advanced. That's why prevention is key. Vitamin D offers you a layer of defense, invisible but deeply important, for preserving your quality of life. In the next and final part, we will bring all of this together with a simple, realistic plan you can follow. And I will share my closing thoughts and encouragement for your healing journey. Part 5. Final summary and health advice. We've now come full circle in understanding how one single vitamin, vitamin D, can play a profound role in the health of people living with diabetes. And if there's one thing I want you to take away from this message, it's this. Simple changes can lead to powerful transformation. Vitamin D is not a trend. It is not a quick fix. It is a foundational nutrient that your body depends on, not just for bone health, but for immune strength, nerve protection, insulin sensitivity, and blood sugar regulation. It supports your heart, your kidneys, your brain, and even your sleep. Let's recap the most important lessons from what we've covered. Vitamin D deficiency is common, especially in people over 50, those with darker skin, or those who spend little time in the sun. This deficiency is strongly linked to higher blood sugar, greater insulin resistance, and increased risk of diabetic complications. Supplementing with vitamin D3, especially when paired with healthy fat and taken consistently, can lead to measurable improvements in fasting glucose, A1C, energy levels, and inflammation. Lifestyle matters. Movement, nutrition, sleep, stress management, and gut health all amplify the benefits of vitamin D. When combined with other nutrients like vitamin K2, magnesium, and omega-3 fatty acids, the impact becomes even greater. Vitamin D is protective, guarding your nerves, your heart, your kidneys, your vision, and your immune function, especially in the long run. So, what should you do next? Here's a simple plan. Get tested. Ask your healthcare provider to check your 25-hydroxyvitamin D level. Start supplementing. For most adults, 2,000 IU of vitamin D3 daily is safe and effective. Adjust based on your test results and your doctor's guidance. Take it with food. Vitamin D is best absorbed with healthy fat, so take your supplement with your biggest meal. Support your lifestyle. Move your body, eat whole foods, sleep well, stay calm, and take care of your gut. Be consistent. Real results come from regular daily habits, not quick fixes. And here's the most important advice I can give you. Do not wait until complications arise to take action. Whether you are newly diagnosed with diabetes, have lived with it for years, or simply want to protect your long-term health, now is the time to act. You deserve to feel well. You deserve to have energy, clarity, and confidence in your body. You deserve to know that you are not powerless, that you can make decisions every day that support your healing and your life. If you found this video helpful, please press the like button and let me know in the comments which part of this journey resonated most with you. Don't forget to subscribe and turn on notifications so you never miss another video that could shift your health in a better direction. Stay informed, stay consistent, stay kind to your body, and I will see you in the next video.